Welcome to Hospitalist Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Michael Beecher, the Director of Hospitalist Medicine at Miller Fillmore Suburban Hospital. Today, we'll be discussing the emerging role of a hospitalist. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Beecher. Thanks for joining us today. We're here to talk about the hospitalist model and how that change is occurring in hospitals. So talk a little bit about the hospitalist, specifically what that means.
So hospitalists are providers, physicians, mid-level providers who've been trained in family medicine, pediatrics, and internal medicine, and we specialize in taking care of patients in the hospital environment almost exclusively.
So that's a change where it used to be the primary care docs actually come see their patients. They'd call on their patients in the hospital. We'll talk about that in a second, but can you talk about the timeline of when that change actually occurred? Because it seems relatively new.
So it's relatively new to this area. It started out more on the West Coast, early 90s, and kind of progressed eastward. Since that time, there's over 50,000 hospitalists in this country. So it's very common, pervasive in most hospital systems now.
Sure. Yourself, your training, talk a little bit about that and how you ended up into the hospitalist program and working for Infinity, here at Suburban Hospital.
Sure. So I did office medicine for almost 10 years, and I used to moonlight for a little bit extra money as a hospitalist at a local hospital. And realized, for me personally, I was more of a creature of the hospital. I find it, more exciting, more rewarding. Patients come in obviously ill, generally get better, go home. So there's more immediate gratification as a physician.
So for the patients who fear that they may not be able to see their primary care doc or they're not connected to their primary care doc while they're in the hospital, why is the hospitalist important in that equation?
So we're basically, obviously, it's an understandable fear or concern when patients come in. Not as much now as maybe 10 years ago. They come in and they're not seeing their primary care provider, or the person who knows them in a familiar face. You get over that really by time. We're allotted more time to spend with the patient as opposed to their primary who comes in who has to get to the office or has other things to do throughout the day. So we could be at the bedside to alleviate that fear for as long as possible, multiple times a day, depending on the issues. So it's a kind of system that quickly, I think, alleviates that. They know we're there all the time for them. We can be called at a moment's notice. So it's our availability, I think, alleviates those anxieties.
Sure, and I think that there may be more benefits than the patient may understand and the patient's family may understand. For the physicians who are, serve as hospitalists, you guys know the nurses, the surgeons, the staff, the ancillary staff. So if you can talk about the benefits of the hospitalist for the patient who may have had a procedure or may have come in for some sort of ailment or illness.
Sure. So I think just being here, being in the hospital for our entire careers, actually, I mean, we know the flow of the system. We know what specialists are available. We know the constraints of the hospital system itself in terms of getting people what they need and getting them out of the hospital as quickly and as safely as possible. We also act as a bridge between the hospital and the community providers. We're constantly in touch with the community providers, both at the time of admission and talking to them at the time of discharge to make sure that the transition is seamless.
So you've become an extension, obviously, of the primary care doc's office as well, because there's a trust factor where they know if their patient does come into somewhere like Suburban Hospital and they are admitted under your hospitalist program per se, that's an extension. They feel that there's a trust factor there?
There is, and we're constantly reaching out and meeting with the community providers to discuss any issues, any things that we can tweak to kind of improve the communication and the care. I think it's important to to understand that, many community providers actually have agreements with us. This isn't something that the community providers have not been agreeable to.
Sure.
So yeah, we're constantly in contact with them, and it's for the benefit of the patient. The patient, we explain that right up front to the patient that we're in contact with their physician. They're often prompting us to do that.
Sure.
So it's a two-way street, and it works.
Are there still physicians who come into the hospitals to see their patients?
There are some. There are not many. I think from year to year that number seems to decrease, but there are some. Yes.
Gotcha. Here at Suburban Hospital, or even at DeGraff, I know that your group has been covering a number of sites. Talk about what's changed in healthcare, or even just like the last 10 years here at Suburban Hospital, how things have really evolved here.
So I think the biggest thing that's changed, as most of us are aware, is the aspect of patient care, patient safety, and the quality of care. There's been a real paradigm shift to thinking more about not only the individual patient, but the system as a whole. So I think hospitalists play an obvious essential role in that, and that we're familiar with the environment. We know the workings of the hospital. There are hospitalist physician leaders who take part in quality, utilization review, sure, et cetera. So we're more ingrained with the hospital. Our success is the hospital's success, and vice versa.
Right.
It's exciting because it's really evolved to that we're involved with the bigger picture as opposed to just at the bedside.
Right. Has the complexity of the patients changed here at a place like Suburban Hospital, which for the longest time was considered a community hospital? It seems like you're seeing a much more changing dynamic when it comes to your patients.
Yeah. So that speaks to why why a lot of primary care providers don't come to the hospital anymore. I think the thresholds for admitting patients to the hospital has increased. So we're seeing sicker people in the hospital. So a primary care provider 20 years ago may have had 10 patients in the hospital, but as the thresholds have increased,
sure, those
numbers per individual provider have decreased to maybe 1-2 patients in the hospital. So the patients are more ill,
sure,
now.
Sure.
So that's, I think, as a specialty, we're tailored to take care of that patient.
Gotcha. Well, Dr. Beecher, thanks for joining us again today. We appreciate your time. Thanks for all that you do for our patients.
Thank you.
I'm Mike Hughes. We'll see you next time on Medically Speaking.